My name is Liz Byrne. I'm a nurse practitioner and I work for the Obstetrics and Gynecology Directorate as a nurse practitioner. My specific role is endometriosis and pelvic pain.
My name's Sarah Spencer. I'm a community midwifery team leader in Cardiff and Vale NHS Trust. Part of my role is being a caseload holder for about 140 women. I look after these women from about 8 weeks antenatally till about 21 days postnatally. I see them in their home environment and also in the GP surgery.
District nursing has sort of been described as the glue that holds together the complex elements that are required to keep somebody at home. And I think because we're going into their homes regularly, we're very well placed to pick up problems at an early stage, and then we can contact the appropriate agencies that the patient might require in order to be able to maintain them at home.
When my son was old enough to go to school independently, I decided to join West3, and it was the best thing I've ever done.
My name's Emma Haynes. I work on East 7 in Landock Hospital. I work 5 days a week. 4 days a week I'm a team leader, and 1 day a week I work as a therapist liaison nurse with patients over the age of 65 with dementia.
We've got a low incidence of development of pressure sore in the unit. We are focusing on the nutrition, assessment of the pressure area, and the repositioning of the patients.
The patients can access me directly by helpline. They can self-refer, so they have far more control and they're far more empowered. We have changed the way that we think how these patients are managed, because we have to recognise it as a chronic condition. And that has to be clearly recognised. And so by bringing in helpline, by bringing in a clinic, by bringing in a pain assessment form, by establishing very good communications with the general practitioners and with the acute pain management team, we have been able to improve the service greatly to the patients, and their satisfaction has been reflected in audit.
I love meeting the different people. It's very diverse. We never know what's going to happen any day, at any time. I love just to help the people and maybe bring a smile to their face even though they're going through a really bad time. And we get lots of really positive feedback of patients and relatives.
I'm proud of the care that we do give, you know. The care that we give is 100% to all of our patients, and that goes through having letters back and lots of just praise off the families and the patients when they finally, you know, when those that finally get well and better, and they can't thank us enough. And that's what just makes me proud, that we go home after our daily jobs and just enjoyed it all.
So our role as nurses in that multidisciplinary team is to look after the patient, to be an advocate for the patient. It is very technical, and a lot of times that takes over, but we just have to make sure that the patient is comfortable. And I always say, if it was me on the table, if it was my mother, how would I like to be treated? And hopefully that's how I treat my patients.